Hey everyone, first, I don't know if I'm going to be able to even post this video. This is the most I've talked out loud for the last couple of days, and pretty sure the reason my voice is like this is I'm in the middle of my treatment round, and we've added tegacycline back in, which makes me feel really sick and vomit a lot. And just 2 days ago I spent the whole night puking my guts out, but there was nothing left to come out, and it was just burning really bad. I know it's really gross to tell you guys, but I think I just kind of maybe burnt the back of my throat a little bit. So hopefully you'll be able to hear me in this video. If not, I'm gonna have to scrap it and try again. But I just wanted to give a little bit of an update to go with the last blog post I just made. And so where I've been at is we recently did 3 full rounds of IV meds, focusing back on babesia, just because I had had a bit of a relapse and it was coming out really strong. In the middle of all of that, around the beginning of August, I hadn't been doing really well, and I had maybe 3 to 5 good days when I was off meds, and our goal is up to 10 to 14. So I did my 3rd round, ending, I don't know, somewhere in the middle of August. It's hard to keep track of all of this now. And I actually had like nearly 10 really good days, and that was huge for me. I haven't had those in a very, very, very long time, if not ever, probably before I started getting super sick. So at least in the last 2 years, I haven't had 10 days in a row where I felt like everyone else kind of feels normal. So that was a huge improvement. Shows a lot of progress with my immune system, being able to handle all of this while I'm not on meds. And then at the beginning of September, sorry guys, at the beginning of September I had another phone consult, and they decided I was going to do 2 more rounds of IV meds. So I'm on, like I said, the middle of the 1st round, and I'll have 1 more to do. There are 4 weeks in total. They're not the easiest, but they hadn't been too bad up until this new round where we're adding tegacycline back in, and that's the one that makes most people really sick. Yeah, and I've just been, it was only like a stretch of 24 hours where I was throwing up so much, but I've just felt so cruddy on the inside. I just feel like a cesspool of garbage floating around in my veins. And I've had yesterday off meds, today Saturday, and tomorrow Sunday, and then I do 3 days of oral antibiotics and get a week and a half off after that. So I'm really hoping that in that week and a half off I start to feel a lot better again, and then I have to repeat all of this over again. So one thing that's been really nice is although I've been super sick, I haven't been in pain, so it's a nice change. I hadn't been dealing with pain as well as I always was. When I can't stand up, when I can't hold myself up, and everything hurts so much, I start feeling so discouraged, and it's making me super cranky now. I'm not as, I don't want to say what we're doing. I just don't feel as happy and like energetic, I guess, or positive as I usually am. Part of that is probably the infection, but at the same time, I've been really sick for a really long time, and I'm so over it, as anyone would be. And I just feel like the longer it's going on, the harder it is mentally as well. So yeah, I don't know. I didn't want to say much. I just wanted to kind of make a video. I've been having a hard time keeping up with regular posts about how things have been going, but I'm hoping to write another blog in October, and I'll make a video to go with that one as well. Been starting to think of my next step here. I always planned to use IV antibiotics. I knew I was sick, and I felt like that was the best option for me at the time, And now I feel like I'm ready to take the next step, meaning I always wanted to take a more natural approach. So right now I'm kind of digging deep into where I want to go with that and what the next step is for me. And I don't want to say much else about it until everything's kind of set in motion, but some big changes are hopefully coming, and fingers crossed they're good changes and I'm making the right decision for me, for my body. I guess that's it for now. Thanks.